For somebody that has the means financially and access to a biological dentist, how would you negotiate that conversation with them if they have, say, 2+ silver fillings? How do they determine if it's worth it for them to have those removed?
So I first would assess, are the fillings failing? So a lot of mercury fillings are cracked or they have open margins. They do break down. They hold up sort of okay, the filling itself, but then it will create microfractures around it. And so the teeth can kind of crumble and break around the filling, which isn't great. So if I start to see signs of that, I want to preserve the tooth. So I would suggest just replacing it. But otherwise, I really need to look at the human. Do they feel like have they had a heavy metal test? If they've had a heavy metal test and they're high in mercury, well, okay, let's talk about how you're getting mercury exposure. Were you eating a lot of this fish or that, etc.? Are you in a career like dentistry where you're exposed to a lot of mercury? Aerosolized mercury, or there's a lot of professions that can be exposed to mercury, or is it from your fillings? We have to discuss that. At which point, if we determine, no, we're worried, there is some heavy metal burden here. This is very important. You have to do this the right way. So you need to be working with a biological dentist who knows what they're doing and is ideally following SMART protocols, which is safe mercury amalgam removal techniques. You really should be working with a functional medicine doctor or naturopath too, because especially if you're sick, if you're immunocompromised, if you have autoimmune disease, if you have Lyme, who knows, if you just have issues going on and we can't figure out what it is, chronic fatigue, etc., stirring up and removing mercury can really make you more sick. So we want to make sure you're optimized. We want to make sure your detox pathways are open. We want to make sure that we have a plan before and after of how to support binding any mercury that you've been exposed to make sure that it's not going to make you more sick. And it can get really pretty bad. I've seen patients get really acute mercury toxicity from having their fillings removed without a proper protocol. Sometimes patients need chelation therapy, but that's nothing to be taken lightly with either. You have to be working with people who know what they're doing. So, I wouldn't rush out to the first person to get your fillings removed. I really do my research and make sure that you're working with someone who is trained in this, So, because sometimes leaving them in is actually better in the short run, than stirring up all that mercury. Because once we drill it out, that's when you're mostly exposed to a lot of it. Now, if you do have mercury fillings, anytime you drink something hot or chew, you are going to get some low level mercury exposures too. And so that can build up over time, and that's not ideal. We probably do want to address that, but I would just do so cautiously. I'd want to make sure you had a really dialed plan.
Do you personally remove mercury from people?
I have. I'm SMART certified. Now, luckily, most kids don't have mercury fillings anymore. So no, I don't. I'm personally happy I don't, because I will tell you, the dentists out there doing it, they're the ones that are sick. They're the ones getting exposed to it the most. So I have friends that's all they do is replace mercury fillings. And they're chronically high in mercury. They have to constantly do detox protocols, even with all of the safety protocols they're using. They tend to get exposed to it. It's the dental staff that tends to be the most exposed. And so, commend your dentists if they're out there doing these procedures, because they are really putting themselves at risk a bit.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Something that quite literally keeps me up at night. I'm very worried about it. I think it's a global epidemic. Not many are speaking about it. It's something called enamel hypoplasia, or it's basically undermineralized enamel.